Thank you for tuning in. I'm Dr. Garth Fisher, and welcome to The Cutting Edge. This show is about more than just aesthetics. It's where health, beauty, culture, and innovation intersect. It's a space to explore the world of entertainment, elite performance, personal transformation, and yes, a little bit of plastic surgery. Each week, I'll be sitting down with thought leaders, icons, athletes, artists, and experts who are shaping our world and doing it with precision, purpose, and impact. This is your front row seat to unfiltered conversations, inspiring journeys, and the science behind the beauty. Let's get started.
I don't think I fit into any of those categories.
You fit in so great. My guest today is Dr. Rob Huizenga, one of the most fascinating and fearless physicians in sports and entertainment. He's a Harvard Medical School graduate and former president of the NFL Physicians Association. Dr. Huizenga first captured national attention with his groundbreaking book, You're Okay, It's Just a Bruise, an unflinching look inside pro football that was so revealing the NFL immediately required every team doctor to sign a non-disclosure agreement afterwards. His insider stories inspired Oliver Stone's hit film, Any Given Sunday. Beyond the gridiron, Dr. Huizenga has become one of the most trusted voices in sports medicine, exercise science, and weight management. He's also appeared on more than 30 national TV shows, from American Gladiators to The Biggest Loser, and has treated some of the world's most high-profile athletes and celebrities. His latest book, Sex, Lies, and STDs, co-authored with Dr. Jeffrey Klausner, tackles one of the most misunderstood and stigmatized areas of public health with straight talk, surprising data, and a practical roadmap for prevention. Today, we'll explore his incredible career, from NFL sidelines to national television, and hear the lessons he's learned about resilience, honesty, and the truth behind some of the biggest medical and cultural myths of our time. Dr. Huizenga, welcome to the show.
Thank you. Wow.
It's so good to have you here.
That didn't sound like me, but I hope.
You're the doctor of all docs. You know, I always thought you're like the best doctor in the world.
Oh, you're very kind. I really appreciate
I've been
that.
working with you for I don't know how many years.
Yeah, we go back a few decades.
We do. So I really want to get to know about the path of your career and the things that you're interested in, and of course we're going to bring up your books and your TV shows and your new ventures. You've been a leader in sports medicine, internal medicine. What's the most exciting innovation you've seen in the past decade?
Well, I mean, that's a really tough question, but I gotta say, since I'm centered around exercise, has really been the basis of my sports career, my medical career, my quote-unquote TV career, that the biggest change has been when and I hate to admit how old I am, maybe we can put some kind of earplugs in your listeners, but
you look 39 years old.
There's a lot of smoke and mirrors in this studio. When I was in medical school, I did have an issue where I just had to work out every day. That's how I got relaxation. That's how I felt better. That was just me. So I worried because I would run out of the Vanderbilt Hall, the Harvard Med dorm, and all the lights were on still when I was working out. And I was like, oh my God, I'm going to really get killed on these tests. And I remember also something even scarier was I taught to we all had like a faculty mentor. And I was just really scared because the medical teaching when I was in med school, and you're talking back in the 1970s, was that vigorous exercise was harmful for your health.
Isn't that crazy?
It was crazy. We knew that, when you run a marathon, your risk of death goes up. We know that. When you do vigorous exercise, your risk of death goes up. But they thought it went up and there was no benefit whatsoever. So I went to my mentor, as I was saying, and I said, I work out every day. What do you think about the health consequences of that? And I never forget, he turned to me and he said, Rob, when I go to the track, I bet on the horses. You were lucky enough to get into Harvard Medical School, which I guess I was, and you have to try to give back to, the people that you're going to serve, and you got to stop this exercise thing. And I always was a little freaked out. Then I came to Cedars, and we had one of the best cardiac hospitals in the world. We had this guy, Swan and Gans, and they invented this little catheter. He apparently was sitting out in Marina del Rey, and he saw these sailboats coming in and out, and he thought, we could do that maybe with this catheter. We could kind of blow up a balloon, let the blood flow, push it right into the heart. So these were the best of the best. Boom. I asked the same question first day at Cedars-Sinai Hospital. They said, yeah, vigorous exercise bad for you. And it wasn't until the mid to late 80s, somebody actually did a study and went, yeah, it's right. When you do vigorous exercise, your risk of death goes up. But commensurate, you get this massive reduction of health consequences for the other, 23 hours of the day when you're not doing vigorous exercise. And no one knew that. And unfortunately, there's still that perception. There's still that thing in medicine, because doctors are smart people. They're bookworms, but they're not athletes. They're not into exercise. And so they pass that same philosophy down to their patients where, yeah, you should do steps, but you shouldn't be doing vigorous exercise. You shouldn't be working out, 9 to, 10 hours a week. And I think that's where we go wrong. So that long-winded answer, a lot of my answers are that way, unfortunately, is, I think, the biggest change in sports medicine.
Well, you know what? I just know we could talk for 4 or 5 hours on this subject, because there's so many things that come out of your answer, which to me, is there a difference between running I just talked to somebody who's fantastic. He ran a 26-mile marathon in 7 different continents in 7 days. And,
yeah, that's quite an accomplishment.
It's either that, or maybe you're working out for 45 minutes a day, doing a lot of cardio and weights and stuff like that. At some point, there's got to be a line where maybe it is kind of detrimental to your health. I don't know. What part of your body gets better the more you use it? Certainly not your joints. I don't know. Your brain.
Well, the joints is that. Let's go right there, because that is another conception that if you're a marathon runner, you're using your knees, your hips repeatedly, and you're going to need a replacement, or you're going to have problems earlier. And in fact, that's not true, because 2 things happen. When you run every day, you wear out your knees and your hips, but you also send a message to your knees and your hip to repair better than the person sitting on the couch. So right. I think the confluence of all the evidence shows running every day does not increase the arthritic damage. What does is some of our unhealthy sports, including the ones that I played, like American football and rugby. And now we can talk about that, how we should reshape all of high school athletics. But pure running does not increase the risk of knee and hip injuries.
I'm sitting here with Dr. Rob Huizenga, who's the top internist, I think, in the world. He's really amazing nutrition, sports science, and everything. And you can't see him. Maybe you want to look up a picture of him. But if he was here in a Speedo, he would look like he came off the Baywatch set. He's sculpted in total good shape. So I'm aspiring to be halfway like him. So what do you think are the most common and overlooked health mistakes people make in their 30s, 40s, and 50s?
Well, I think that they are ignoring the number one recommendation for longevity and increased health span, which is getting incredibly fit. People come to me repeatedly for tips on how can I have a better life? How can I live longer and live better? And sadly, they're talking about, should I do 6,000 or 7,000 or 10,000 steps? Obviously, the more steps you can do, the better. Some people just have come out with a study saying 7,000 steps is better than 10,000 steps. Not true, but maybe for the time you spend, that's true. But doing vigorous exercise, doing weight work in addition to the aerobics is far superior. So that, number one, people think they're fit and they're not. Number two, people think they're ideal weight and they're not. There are so many people that are skinny fat, and we're not addressing that. And that leads to some of these, what I call the 6 big pillars of disease late in life. And if you want to battle that, if you want to lower the chance of getting Alzheimer's, getting some kind of metabolic disease, getting cancer, getting, the ones that people never talk about is arthritis and immune health. If you want to battle those things, and cardiovascular disease is the number one, if you want to battle those things, you got to start when you're 25 or 30. You can kind of go on your good looks and age, but once you hit the big 3-0, you have to have a plan. And it's always better to start later, better to start today than tomorrow. But if you want to maximize your youth, you got to essentially, and this sounds draconian, work out 6 to 7 days a week, starting in your 30s.
Is it too late for a person in their 50s or 60s?
It's never too late. It's never too late for somebody 82. However, you're better off if you started at 32 than 82, but better 82 than 83.
Right. I think how long people live, I think that's increased a little bit. Maybe from a lot of different things, being able to diagnose diseases also, and maybe people are working out more and watching their diets.
Well, I think this is the first wave, as you remember. Well, you don't remember, you're a little younger than me, but as you know, there was a big wave of runners and people that really took their health seriously. And we're just getting now to, people in their 70s like myself who have worked out essentially every day of their life. And we're going to see what that does, because we've really never had, the people that are 100 now, are still the people that, oh, my grandmother's 100 and she smoked cigarettes or she never did anything, which is certainly possible. But we've always wondered, hey, those people that didn't do everything, would they have lived to 120, and we're going to find that out very quickly.
Well, you see these studies that, almost it's like food is toxins, and the people that eat less are living longer, and you go back to these studies, obviously unfortunate people in the, concentration camps that look like they're still around, a lot of these people over 100 years old.
Well, there is something to underfeeding, both pets as well as humans, and it's not a great life. And so we like to try to cut it and do fasting mimetics. And I think that's the big new wave is, probably being 10% underweight is a positive thing, but it's a miserable life.
Yeah, it is.
And I think you have to factor in happiness and sociability. You can also go on a ketogenic diet. It's just a miserable, unsocial life. And so we have to kind of factor that all in, and that was part of the problem with COVID. Yeah, if you want to achieve no COVID infection, this is what we do. But that's not the best thing for living longer and living healthily.
Right. Well, my dog's not going to tolerate that diet. I think he wants to be overfed at all times. So you're the team doctor for the Los Angeles Raiders. I want to hear what that was about. That must have been very exciting.
That was like being a kid in a candy store. I mean, I've always been an athlete. I've always been a sports fan. Wasn't quite good enough to be a pro in a legitimate sport. I was good in wrestling, and unfortunately there was no real wrestling that wasn't real. And, you're playing catch with Jim Plunkett. I'm catching punts from Ray Guy. We're out on road trips, hitting the strip clubs with the guys the night before the game.
Wow.
It was just a dream.
Wow.
And, there was actually a little medicine there too, trying to treat some of these guys that would lose 25 to 30 pounds in dehydration in a game, and what the repercussions were, and trying to change things around and taking the wrong sleeping pills. So it was something where I learned a massive amount.
I'm sure you did. I can imagine the situations you were put in. And was there ever a time that you felt torn in between doing what was best for the athlete, his health, and the pressures of the team or the league in the middle of a game or the season?
Well, obviously, one of the key points in the book I wrote, You're Okay, It's Just a Bruise, and subsequently in the Oliver Stone's film, Any Given Sunday, was we had a key player in the middle of a game. We had a great start. I think it was 1991, and he just lay motionless on the field. So, of course, we'd sprint out there, and I'm like, what's the matter? And he goes, Doc, I can't feel my hands. I can't feel my feet. I'm completely numb. And we're like, oh, shit. Because, we know about the Darryl Stingley episode. We're totally prepped for that. And then magically, like as if from God, he regains total sensation, starts moving slowly, gets up and goes to the sideline. And so, I'm talking to him on the sideline, and I'm like, you got to get this worked up, because sometimes transient quadriplegia can be a sign of a severe cervical problem.
Right.
So basically, at that point, we had a major issue, because the other team doctor said, I don't want to work this up. And, we did an x-ray on him, which was abnormal, and it was deep 6 or some major pressures. And so we had to, off schedule, have him go see another doctor who said, you need a surgery before you go back in and play. But this was a guy that was vital. We were 5-0, and there were huge pressures put on. There was another doctor called in that said, no, he was fine to play. So that was probably one of the most poignant, difficult times in my life.
But it's certainly different now. I mean, back in the day, they would inject him with a little, Novocaine, lidocaine, whatever, and send him back in, right?
Sure. We would, individuals back in the day would get concussions, multiple concussions, and we'd basically ask them, what's the score? So I remember one time I went out there, Bill Packel, who was like right next to Howie Long, big buddies, and I said, Bill, what's the score? And he just looked at me and go, Doc, I'm a defensive lineman. They don't pay me enough to remember what the score is. I go, okay, you're back in. That's a good line. So that was like the medical exam back in the day.
Wow.
There was none of the concussion protocol that they have now, obviously.
I even heard that they had, I think John Madden had talked about, they had, putting on these pads that were really, made out of plaster of Paris. They were like almost cement. I mean, there's all kinds of stuff
That
going
was
on
one of
back
our
then.
trainers' inventions, where you'd have kind of that forearm shiver, where they would really get out there and do some damage. So, yeah, it was, but we had to do the best. We would have people come up to me and, people that probably could have benefited from anabolic steroids that were thin and prone to injuries and say, Doc, should I go on anabolic steroids? And I'd say, absolutely not. We've got to think about your health before your football career. But that's tough when big money is at stake and you get emotional. Even a team doctor wants to win a Super Bowl when it comes right down to it, because you'd like to walk around with that Super Bowl ring as much as anybody else.
Right. The players want to win. This is in their body, their fiber.
Well, if they didn't want to win, they wouldn't be at that level. So
exactly.
That's why I've always said it's the team doctor's job, not the athletes, to throw out the white towel and to halt the play. I don't really think it's fair to say, well, the athlete wanted to play. Well, of course, they're maniacal and that's the attitude it takes to get to that level. So it's incumbent on an ethical doctor to kind of slow down their requests, which they universally regret 20, 25 years later.
Yes, I agree. This may be, your book, You're Okay, It's Just a Bruise, is a fantastic book. And was that part of you were one of the first people to sound the alarm, about long-term brain damage, CTE with NFL players? Is this something that was covered in the book, or is this when it started?
I'm very proud to say that I was the first one that mentioned, the effects of chronic concussions in the book and compared it to what we had seen in professional boxers and what we had seen in other sports, and talked about what we were doing and what might accrue, because we could only draw images on some of the boxers that I had seen. The quote unquote CTE story hadn't really even been opened yet, and it was opened by several very, very sharp people later. But yeah, it was the first time that we really, raised the question, should we be doing more? Were we doing enough?
Okay. Well, I think, I always wonder, maybe you can add to this, even when they're sparring and they have these headpieces on and they're getting hit so hard with the headpiece on, it's still jarring their brain, like contracus and all these different things. I'm not, maybe it does help a little bit, but I don't see how that, sparring with pads on is really, it's helping a little bit, but not all the way, right?
That is correct. It's like a football helmet. I mean, the question is, a football helmet is helping, but it's certainly not helping all the way. And now they're getting better helmets with more ability to absorb that shock. We put transducers in there, and you can see the exact amount of force applied to the brain. And the brain is this gooey substance inside this rock-hard skull. And it vibrates in there, and that vibration causes damage. And that's true for boxers with headgear on and without. It's true for football players. And the better the headgear, the less force gets transmitted, but there is always going to be force transmitted in that sort of situation. There are different rules I think they could even do now. Linemen, if you start in a pass blocking mode, you may negate some of the head down run blocking head injuries. And there are certain rules that have been enacted and even more that can be done in terms of teaching proper tackling. I'm a huge fan of football. I played football myself, but we have to ask ourselves the question, especially for high school athletes. It's one thing if you're a professional and getting recognition and earning a massive living, but for high school athletes, is that worthwhile for your son or daughter in soccer, making big head hits in soccer? Is that worth the camaraderie? Is that worth the training of a team effort? Because there's great stuff, great attributes that you get from playing in sports, but is that the right sport? And the answer is probably not.
Yeah, that's going to be a huge issue for somebody to kind of put their arms around as a parent. Your kids want to go play, and they just don't understand it. We know more now than we used to know, which helps when you have some data to back it up. But I think there's more transparency now than there used to be, obviously, in sports. Don't you agree?
Well, at least you're not. When I was in high school football, they would get a circle and you'd be in the middle and you're supposed to run as hard as you can into everybody else with a helmet. So, the practices aren't as insane as they were back in my day. But, there's always ways to make things better and safer. And, if you had your choice, it's just not the right sport.
Hi, it's Dr. Garth Fisher on The Cutting Edge. I'm here with Dr. Rob Huizenga, who is the past doctor for the Los Angeles Raiders. He's a premier internist, nutrition, sports medicine from Harvard. We're talking about the Raiders. We're also going to talk about TV shows he started. What do you think with these athletes is worse? Is it the long-term strain on their bodies from the physical abuse they've gone through, or is it the emotional toll and possibly brain injuries and things like that? What is?
Well, they earn a lot of money. They get a lot of recognition, but it comes at a huge cost. We call it the post-player syndrome. They describe it like, when you're a player, it's like a fresh can of Coca-Cola and, you're drinking it and the bubbles are there. And then, you retire and there's no more drink inside the thing. And then 5 years later, you're hard to play basketball with your kid and that can is crumpled. And then, by 20 years, no one has any idea who you are. You need your shoulders, your hips, your knees replaced, and then, the can just gets stomped on and crumpled. And, so you have to ask yourself, is that the way that you want these people that are entertaining you to be remembered? And a lot of my friends who I took care of are really struggling now because they have no health insurance. They've run out of money. They are unemployable, and it's very difficult for a good fraction of these guys that are just so beat up. They're miserable, and they really have limited options.
Well, the problem really happens when you're 18, 17, 16 years old, and you're a superior athlete, and you've got this bright future, and you can do all these things that other people can't do, and and you get pushed into this corridor of sports and athletics, and they don't look at the future because you feel like you're into, when you're 19 years old, nothing's going to hurt you.
Part of the allure of pro sports is you're invincible and you're a gladiator.
And the money.
And the money, and you take that. But again, it would be great if we can funnel our athletes to similarly competitive sports with less long-term injuries. And that's why, especially for high schoolers, we got to funnel them to track and field and even soccer. But soccer has its downsides, and probably heading should be completely eliminated in soccer.
Yeah. I mean, anything wrong with you, he'll find it because he's so brilliant. But he really, I think you were known for a long time because all these VIP people that I know, you're their doctor, and that's kind of how I found you. Not because I was a VIP, but I figured they knew what they were doing. So, and he's kept me upright. But you really became nationally known for that great show, The Biggest Loser. And I wanted to talk to you about how that show really was. What was it like behind the scenes? I know you probably developed and guided that.
Well, that was also another very interesting onset, and that started back, I think, 2002, 2003. Got in a room, and we were modeling a little bit off of a show that you had been on, Extreme Makeover, and I was like the assistant to the assistant to the associate on that show, where you were starring on that. And the producers wanted a show with just grocery store food and exercise to see if they could make a transformation like you were making a transformation with a surgical procedure. And so that's how it began, and we discussed different ways to make a change in people. And it came back to my observation when I was the doctor of the Raiders, or I was still the doctor of the Raiders at that time, that these individuals worked out for about 3 hours a day, ate everything they could, and lost massive amounts of weight. So I said, let's work out 3 hours a day and moderate the food. Let's give the guys 1,800 calories, the women 1,200 calories. We'll work them all out 2 to 3 hours a day, which had never been done, especially in sedentary, morbidly obese people. So we didn't know what the heck that was going to do. So it was a little scary because I knew what happened with world-class athletes. We had no idea what happened with sedentary couch potatoes. So that was the premise of the show, that we came up together. And then just as a funny aside, this is where I made probably one of the craziest business decisions of my life, they were dividing up the points for the show, among the people in the room when we came up with it. And there was a famous case of a doctor who owned the Boston Red Sox, and he was giving medical advice to some of the players, and that was a huge ethical no-no. So I said, well, I can't really be an owner of this show because I'm going to be the doctor, and I can't be giving advice to people where I have a financial incentive to potentially give them bad advice. That decision cost me $500 million.
Yes, of course.
But I guess I'll get over it.
You look very rich, Rob.
I'll try to. I'm trying to overcome the stupidest business decision of my life.
No, it's okay.
But so that was a huge challenge because we had people with that protocol losing weight amounts that had never been seen. We had people losing 10, 12, 15 pounds a week that had never, ever been done. No one had ever combined real exercise, as in professional athlete level exercise, with a conscientious diet. And so in doing that, we saw amazing things. On the other hand, when you take a sedentary person and you work them out that much, there's huge orthopedic problems. And so we had a massive staff. It was pretty much just like being in pro football. We would have 3 or 4 trainers taking care of the injuries that we got, but we figured out a way, even in the face of injuries, to keep people working out, whether it was in the pool, on bikes, on anti-gravity treadmills, etc. So it was a real huge medical experiment, and one that really proved for the first time you can lose weight based on exercise. It's always been thought you can't, but you do need to do a lot of exercise.
So, look at all these people taking the shots and, trying to lose weight on that. I mean, I think what I've heard is, a lot of these, they regain their weight once they stop. But if you can just maintain this diet exercise program that you showed so successfully on that show, that's probably the best way to do it.
Well, but it's very hard to maintain that too. Unfortunately, our people, we've got we know exactly what happens. These people went home. They all felt great. They all looked great. They didn't have Ozempic face because they lost literally hundreds of pounds. I think one of the winners lost 240 pounds. So we were losing huge amounts, never before seen with bypass surgery or anything else. And they looked great. Why? Because they lost all fat. They didn't lose any muscle. And a lot of people with GLP-1 agonists, as may lose up to 40 or more % muscle. That's how they get the dragged look, the drop look. So we had a system down. But when you go home and you don't have really aggressive oversight, and you have doctors and other healthcare staff that's really not into that, and you have no support from the home, it's very difficult. And so we found when we did our 6-week follow-up on these individuals, probably, about a third did really well, and probably about 2/3 didn't. But still, our average weight loss for the entirety of the group averaged somewhere around 12 to 15%, which was still the most weight loss at 6 years long-term ever documented in any university study. So I was very proud of that. Sure, we had recidivism. We had people regain all their weight. But even there, it was interesting. Some of the people that regained all their weight were still exercising, and metabolically, although they were worse than they were on the end of the loser show, were better off. And so I was very, very proud of that six-year follow-up data.
It was a fantastic show that motivated so many people, and I will say that, kind of running parallel with my show, that, when you do these procedures on massive weight loss patients, they look in the mirror and they're like, wow, I look really good. You take all this weight away, then you take the skin away, and it keeps them motivated because they've kind of gotten over the hurdle and improves their confidence and their desire and drive to kind of stay in that position. So, this is a whole hour show talking about weight loss and nutrition, and Dr. Phil used to have the greatest line: if you don't like it, just stop doing it. That's the easy solution if you're eating too much, but it's hard to do.
Well, you know what? To amplify that, there's 12 hormones in your body that are telling you to eat. There's really only 1 or 2 things that are saying don't eat. One of them is actually vigorous exercise. So people have a huge biological drive to eat, very, very little supporting that mental desire to lose weight. And so, it's much harder than it looks. If you drop out of the vigorous exercise side of it, you've got very little that can suppress these 12 hormones screaming, literally screaming at you, saying, you've just been through the worst fast of your life. You gotta eat. You gotta eat. You could die. That's what the brain's telling you. And so it takes a lot to overcome that. It really does.
And all these nice restaurants doesn't help either. Um, maybe if you lived in Kansas, but I'm from Mississippi. They didn't have the greatest restaurants
in
there.
Kansas, actually, Kansas City, yeah, some great steak restaurants. So, yeah, there. I don't know if there's any place without great food in the country.
What is Fit for TV, the reality of The Biggest Loser? What is that?
Well, Netflix has coming out very shortly, and God knows what's in it, a 3-part documentary on The Biggest Loser, and I'm sure it'll be very controversial, and it's a behind-the-scenes look at the show. So I think it's going to be very interesting. So we're all kind of holding our breath and seeing what it is. But there obviously we had something like 382 contestants that all lost an average of 100 pounds, and some of the contestants, not unsurprisingly, are not happy. Many of them are very, very happy of what they accomplished and where they're at now. But it's going to be really interesting, and I'm actually looking forward to it. I'm holding my fingers. But
we're
going
to see your face on it, I'm sure.
I think I'll be on it a little bit. Yeah.
Okay. Good. Well, I've been trying to lose weight since I saw you last. I just wore a looser shirt, so maybe you can't
Well, that's
tell.
the whole thing is, you wear loose pants, loose shirts. And the greatest thing is Donna Carrington, back in the 1990s, she found that if you just change what the dress size is, many more women will buy it. So in other words, a woman that used to buy a 12 dress, Donna Carrington just said, no, I'm going to make that size dress, but I'm going to put a 10 on it.
Oh, isn't that great?
And the sales just skyrocketed up. So what happens now for men's pants is you go, oh, yeah, I wear a 36 pants. Now measure what the pants is. That's really a 38-inch pants. So that the number of the waist size on men's pants has no relationship to what your size is. I mean, I would love to go to a fair. I could make so much money. People walk up, and we'll see who can predict their waist size better. And I'll say to them, okay, what do you think your waist size is? And they go, I think it's 38. And they go, I wear a 38 pant. And I'll go, 41. And I'll kill it. I would make so much money.
Wow, that's great.
People have no idea what their waist size is.
What do you think of these rapid weight loss, things people are doing? Are they sustainable? The plans, programs, eating.
Well, the GLP-1 agonists, the trizepatide, semaglutide, they are game changer drugs, and they need to be policed very carefully, because if you just take it and don't eat, well, that's not very healthy, right? Because if you want to lose weight, I could give you HIV or cancer,
right?
Guaranteed to lose weight,
or divorce.
Or a divorce,
right?
Exactly. Or I can
divorce
have somebody.
Side.
Yeah, as a doctor, you can get sued, but those aren't healthy ways of doing it. And people look at you and they go, "Wow, you look sick. Are you okay?" And whoa, I just lost 40 pounds. No, you look bad. So there's a total difference between losing excess fat and losing muscle, or losing essential fat. We even had a couple times on Biggest Loser, people would go beyond losing acceptable fat. That's not right either. You want to lose excess fat, not weight. This whole thing about losing weight, forget it.
Right, it's the fat. I'm here with Dr. Rob Huizenga, premier internal medicine doctor in the world, and he's who I go to for anti-aging. I really trust him. I know he's brilliant. He knows the most about this. So I like talking to him about that. So let's talk about anti-aging. And what are your thoughts on testosterone therapy, all the different things, metformin, anti-aging products? What do you...
Well, there's a lot about,
that's a huge
field, as you know, massive. Matt, we could go for a year on that. But I think the first thing is people want to go for the quick fixes, the small molecules. I'd like to take metformin. I'd like to take rapamycin. I'd like to take an NMN or a NAD precursor, or one of the other agarbos. The main thing is you got to do the basic building blocks before you start there. And so we get back to exercise. That's been proven in spades to lower the risk of cancer, lower the risk of atherosclerosis, lower the risk of Alzheimer's, and maybe even slightly lower the risk of arthritis that we were talking about earlier. So I think that you got to start there, and then you can't just say, well, I exercise, I go to yoga twice a week. you've got to be fully fit, and that takes a lot of time and effort. Then you have to look at your body composition, and you can't look at weight. Any doctor, especially a longevity doctor that talks to you about your BMI, you can just cross that name right off of your list. The weight has nothing to do with BMI. Based on BMI, I am overweight, close to obese, and I have like a 12% body fat. So those people don't have any clue. You need to get a body composition done. You need to go to get a bod pod or a DEXA scan, and you need to see, of your weight, you might have a low body fat and have no muscle, sarcopenia. That's very, very dangerous. You might have a little fat, but it's all in the wrong place. It's all in your belly, or it's marbled in your liver. So those are key things, and you want an ideal body composition. And speaking of longevity, if you came to me, what do you think, from your end of the world, what are the two most important tests that signal your health?
Well, you've always said body fat composition, I think, because I always do that test, and then endurance on the treadmill.
That's
right?
exact. That's in the top three. So endurance on the treadmill, something called VO2 max. That tests how your heart works, how your lungs work in terms of getting oxygen, how your muscles work, how your vascular system works, and your neurologic system to coordinate all that. That's your VO2 max, best indicator. So if you say, I smoke cigarettes, I go, Garth, you're increasing your chance of dying by 250%. If you say, oh, I have kidney failure, I mean, that's a nightmare, right? You're increasing your chance of dying at whatever interval we pick, 300%. But if you say, I'm in the lowest quarter of people fitness versus in the top 2.5%, that's a 500%. We've got no other marker that separates you. And strength may be similar. So even gross gauges like grip strength or, what's your peak bench press, those are the key thing. And then your body fat comes in. So when you're talking about anti-aging, we got to start with those, but everybody wants to jump to the things that I believe are important. I read about them night and day. I'm really interested in them, but those are the minor factors that are the extra 5 or 10%.
Well, they're all reaching for bottles, and you don't know what to get. You go to the store, and there's every shape and size of every.
I don't know necessarily.
I know, and I like the fact that you're looking for measurables, because I believe in that. I don't think you should just take this vitamin because it's going to lengthen your life. Nobody knows. There's not studies that have ever been done that long. But the big one is NMN, NAD, and of course, you always told me. The problem is you've got to have a sufficient volume of that in you can't just take a capsule and think this is going to lengthen my life. So, I mean, where should people be guided with NMN and NAD? Because I think they're getting hooked.
Let's start with, I mean, obviously it's out there. You can't flip a page on Instagram without reading about the NAD. The first thing is NAD drips. You can go to multiple clinics and get intravenous NAD. NAD has only been studied in IV drips. I think there's 2 or 3 studies, and they're interesting, but they really tell us very little. People get a big bolus of NAD, and they get really crushing chest pain for a little while. I mean, that's like a red flag. Now, the other red flag is NAD isn't in our bloodstream. NAD is an intracellular essential compound, but it's not in the bloodstream. So it has to be broken down in the liver and reformed to either NR or NMN to get in the cells. So it makes no sense. Same thing with sublingual. And then people that take oral, it's not absorbed. So there's so much baloney out there. Then, if you elect, as I have, to take an NMN product orally, there's so much nuance to that because, there are certain compounds that will increase its absorption. There's a lot of blocks there. There are certain compounds that you need to take because if you take a massive amount of it, it also increases the breakdown products, one of which is nicotinamide. And nicotinamide is the single most potent negative feedback loop inhibitor on this whole NAD system, which is driving maybe over 600 different enzymes. It does something to the tails of those enzymes. It does something in redox reactions. And it's an essential ingredient for like sirtuins, which are so important to, make mitochondria run the right way, make DNA to be healed. So you don't want to change any of these these feedback loop inhibitors, and there's even something where some of this product, nicotinamide, is metabolized with a system that if you don't give something that's got a betaine in it, you may be deficient in your one carbon transfer system. So it's so nuanced that just taking one product at 1/10 the dose of what we're giving mice, where the excitement really has begun. And mice, there's a lot of differences between mice, especially these clone mice that are living in, a protected environment where they can't get infections. And the mice are all very strange because they're basically all clones. So it's like giving all these tests to just one person. And it's just very dangerous to kind of jump and make associations with humans, and you have to follow it. You have to follow and see, okay, if you're going to take, an NMN cocktail, or if you're going to take rapamycin, if you're going to do plasma exchange, all these things that are discussed, well, what's changing? Is your hair growing faster? Does your skin change?
And you've been measuring that with your studies.
We've been measuring that.
Yeah.
And if you're not measuring it, shame on you. Or if you're like, there's another popular person, I don't know, popular or unpopular online, that does 75 different things. How can you mix and match at that level and know what's going on? It's really an embarrassment.
Well, I think that's the take-home point, is just kind of clearing all the weeds out of just trying to look through this. And that's the last point that you made, I think, is the most important one that everybody needs to know about. And you just can't go expect to take a couple bottles of and pills and think that that's going to work. Well, let's talk about, just quickly, you have a book, Sex, Lies, and STDs. That's totally different.
Yeah, but that was totally out of my wheelhouse. And this was a case of, every once in a while I get a bug up my rear end and go, I know nothing about this. And this was the case that I did a relatively well-known appearance on a national morning show with Charlie Sheen, and he had a very unfortunate diagnosis. He contracted HIV, and there was so much misinformation, so many things said about that I said, I just have to sit down. I'm going to take 6 months out of my life. I'm going to learn everything about HIV. Because at that time, something that back from the HIV era, like I was in the 1980s, where it was uniformly a cause of death. It was spread initially. We didn't even know how it was spread. And even when we found out it was mainly spread via sex and blood products, it was still an incredibly scary time where people wouldn't have sex with somebody even if they had condoms on, and for fear of HIV. And now someone with HIV, fully treated, a 0% chance of transferring it. And no one knew that. And that's why I wanted to write this book. And then when I wrote that chapter on HIV, I went, people don't know anything about chlamydia, about mycoplasma. I certainly didn't. And so I wrote this book really for myself. But what came out of it is no one has any idea. People think that they're going to get a symptom and go online and figure out what it was. But the number one thing takeaway from this book is the vast majority of STDs have no symptoms, and you got to go into a prevention mode. So if you think you're going to find the symptom and then treat it, you're totally off base.
Right. Mostly there's no symptoms. And it's even more symptoms, I think, for men than there are for women. Right?
Men tend to have more symptoms, and that's why, gosh forbid, if a guy calls you up, women, and says, I'm so sorry, I have an STD, you should be on your hands and knees saying, thank you very, very much for being honest with me, because I have no symptoms. The women has much, and that's why women's rates of STDs of continuing to have these things is so much higher, because they don't get the warning signals that men more often do.
Right. Well, it's been such a pleasure. I've been here with Dr. Robert Huizenga, who's a premier internist and internal medicine doctor, sports medicine, fitness medicine, you name it, written books. And I want to have you again, because, I mean, this could have gone on for hours and hours. I wanted to delve a little bit more into it. I want to thank KCBS, Odyssey, our sponsors, Cal and Mike, who are our producers, and, of course, you, the listeners. I'm Dr. Garth Fisher with The Cutting Edge. We're going to see you next week. And thank you again, Dr. Huizenga.
Appreciate it. Thanks.